There's a couple of things that that you need to think about when you're engaging in a planning process with one of your healthcare clients. You have to understand where they are, whether this is a turnaround for them. Some of the institutions that we work for have been purchased by for-profit or not-for-profit health systems for the purpose of being converted into a different type of facility. You have to understand if it's a turnaround, if it's a leading institution that's simply looking to amplify its reputation. Johns Hopkins, for example, which is a client of ours, obviously is not trying to turn itself around. It's looking to do everything it can to maintain its position. And you have obviously a wide variety of institutions in between those. So you have to understand who you're dealing with and what it is they're trying to achieve in the planning process. The other thing you need to understand is what kind of a house it is. There are lots of continuous process improvement has been branded, right? You hear about lean process, Six Sigma. For those of you that have been doing this for more than 15 years, you might remember quality circles, TQM. The continuous quality process improvement is not a new idea, but it's a good idea, and it's an important idea. So you need to understand what kind of a house you're dealing with. We have clients who are heavily invested in lean processes. We have clients who are Six Sigma houses and so on. So you have to understand sort of how they've organized themselves to improve their own processes. And what you need to bring to that, as Anita was pointing out earlier, is an understanding of how their new operations, whether it's within the acute center or it's the design of the health system itself, is going to be influenced either by the delivery of health care or by the technologies that they're going to use to deliver that care. All of those things are going to influence your planning work and how you put your projects together. They're also going to influence how you deliver the projects. Mary Jean mentioned a moment ago that she's seeing a lot of her large-scale healthcare clients institute new ambulatory care centers. We're seeing the same thing. Speed matters to these clients. We just finished a 150,000 square foot ambulatory center for the University of Pennsylvania on a design-build basis, where we came to the table obviously with the builder, with an understanding of what that project needed to be, and delivered it from start to finish in about 14 months. LEED Gold, green roofs, high-performance building, but this is what you need to understand going into the game, is that the clients, for the most part, our clients' expectations haven't been dialed back in terms of the performance of the building or the performance of their design team, just because there might be some economic or operational stress placed on the organization. In fact, it's quite the opposite. So they're looking for us to help bring ways to connect their new, more efficient, streamlined operations to our new, more efficient, streamlined facilities. And so it starts with how they want to work. The way that really gets connected is by spending time at the beginning of the project understanding what it is the physicians and the nurses want to do in the facility, and then designing the facility to support that, and how the technologies that they're using to do that may change or evolve over a 3 to 5 year time frame going forward. So backing up to the beginning, you've got to set goals, and they have to be real goals, not just we want to be the best. You know, that's not a measurable goal, that's not a useful goal. It needs to be, you need to set goals for yourself that you can use as a yardstick to measure the quality of the facility that you've created. So that 3 months into the project, you can take a step back and you can say, okay, we had a certain level of performance we established for the building, and this building is going to perform at that level. This building needed to do a certain number of procedures, and it's going to be able to do that number of procedures. We needed to deliver it for this amount of money, and we think we'll be able to deliver it for that amount of money. They have to be real tangible goals, and you have to show that you're meeting them. And so I think that's how you can start to connect the design process and the overall planning process to the process improvement goals of your clients. We spend a lot of time using simulation tools. We call them 4D, in addition to the 3D and conventional 2D tools. One of the things I think everybody on this panel figured out a long time ago is that your average nurse or your average doctor, whether or not they're an amateur architect, Anita, probably can't read a floor plan. In fact, they probably can't read any two-dimensional drawings. What they need to see are three-dimensional drawings, photographs. It's not going to be exactly this, but it's going to look something like this. Several years ago, we started using three-dimensional virtual animations in our design process. They were static images, computer-generated, so people could see what they looked like. They were much more effective. What we're able to do now is actually model the process. So we're doing a project right now for North Shore where we're using a simulation software that takes our design from AutoCAD in 3D and lays into it the operational model that the hospital has developed. So you can actually sort of switch the thing on and watch the emergency department work for an 8-hour period. It takes about 10 or 15 minutes for this thing to run. But what you can start to see while you're doing it is where the bottlenecks are happening and what your new design has created, where it's working and where it's not working in terms of patient flow, in terms of procedure durations, in terms of the overall layout of the department, and so on. And this is really important because one of the things we like to tell our clients, just to kind of get their attention, is that we don't really care about their problems. And the reason we tell them this is because a new facility is going to give them a whole new set of problems. The worst trap you can fall into when you're designing a new facility is to try to use that project to fix everything that's wrong with your current facility. That's not what you're doing. Your new project should be a forward look. And what you should be doing is thinking about where you want to be 5, 10, 12 years out. Not how can I fix the problem that I have today, but where do I want to be 10 years from now? And that's the context for designing your project. And to be able to do that requires a little foresight, it requires a little vision in terms of the evolution of the technology. It also requires an understanding of the thing yet to be created. And that takes a bit of an investment on the part of the designers, on the part of the owners, and on the part of the medical staff. In a lot of ways, this region is lagging the rest of the country, maybe the rest of the planet, in terms of delivering large, complex projects. It just is. Historically, it's been a highly compartmentalized delivery system. And virtually every place else, all of those compartments are being broken down. And I think what you're seeing here is the construction management firms, the architects, the engineers, the owners, the institutions, are all trying to figure out ways to work around the system. We're all sort of coming up with workarounds so that we can work in ways that appear to be integrated. So you're seeing design assist and things like that. These are important. These are the right steps for us to be taking. What we need is a different regulatory environment that allows us to do this. And we need Frank, I hate to say this, I'm going to get myself in trouble with my colleagues to my left here, but
turn this off?
no, don't do that. But we do need the owners' legal representatives to sit down and with the rest of the community and come up with language that's going to allow this to happen. And that's going to take some hard work. I mean, that's going to take and a little time, but we're going to have to sit down and roll up our sleeves and talk about what it takes to put together a tripartite contract that works for everybody in this region so that we can do this. And that's a heavy lift. I know that's a heavy lift. But it's happening in a lot of other places. It's not impossible. And at the end of the day, it's going to be better for the owners. The projects will happen much more smoothly, more efficiently. We've seen this where we've been able to do it. Even where we've had to trick the system a little bit, it's worked better than the conventional design it, bid it, build it model that we've all been functioning under for the last 50 years. So it's going to take a little work, but I think it would be time well spent to try to get us there. I think part of what's on the learning curve is embedding the process of dealing with materials from the time they show up on campus until the time they have to be disposed of and taken off of the campus into the design and planning process, which is historically something that we've left out. I don't know if that means I'm supposed to stop talking now or what.
That was an energy saving.
All right, we just saved a
No,
nickel.
it's a switch from positive to negative pressure.
But so it goes to somebody's earlier comment about user groups and what constitutes a kind of representative cross-section of the institution. If we're designing a hospital these days, it's just not sufficient to sit down with doctors and nurses to design the hospital. You really need to involve everybody who's working in the facility, in the design of the facility, and you need to understand what it is that they're doing. I mean, our own approach is that at Francis Cauffman, you're going to get a LEED Silver building or better. That's just what we do. It's embedded in the process. It's how we work. If you don't ask us, if you don't tell us, that's what's going to happen. Generally, though, what we like to do is think in terms of building performance. I think the U.S. Green Building Council has done an outstanding job of putting sustainability on everybody's radar, but LEED certification and LEED Silver are not particularly onerous standards for building performance. I think it's what's going to start to happen is people are going to think in terms of the performance of their buildings and what they're doing with their materials and worry a little bit less about where the bike racks are. So.